Welcome, everybody, and thank you for joining us today for Closing the Gaps, Achieving Survey Readiness in Acute Dialysis. We are so glad that you're here today. Today's session is all about building a dialysis program that's consistently compliant, not just when the surveyors show up. We have a great conversation lined up, and I think you'll walk away with some practical ideas you can put to work right away. A couple of quick housekeeping notes before we get started. A brief disclosure: the views and experiences shared by our guests today are of their own and don't constitute claims, endorsements, or guarantees by Outset Medical. Individual results may vary, and nothing discussed today should be interpreted as a promise or representation regarding our products or services. We want this to be very interactive, so please drop your questions in the chat as they come to you. We'll make sure we get to them. And if you can't stay for the whole webinar today or want to revisit anything, don't you worry. We'll be recording today's session and sharing it out afterwards. With that, I'm thrilled to hand things over to our speakers. Please welcome Brittany and Tricia.
Thank you, Ariel. Good afternoon. My name is Brittany McGill, and I am the Chief Nursing Officer of Outset Medical. And I want to welcome and thank Ms. Tricia Allen for joining us today and taking time out of your very busy schedule to help our professional peers across the country be successful in the space of accreditation. And so, Tricia, if you'll start by just introducing yourself and telling us a little bit about your background and your organization.
Sure. Good afternoon, everyone. So as Brittany said, I'm Tricia Allen, and I manage the dialysis services at one of the AdventHealth hospitals here in Florida, AdventHealth Ocala. But I've been part of the health system now for many, many years, and we have stood up 30-something insourced dialysis programs across the AdventHealth system. And so we feel pretty confident that we're kind of doing some best practices, and we wanted to kind of show and share that with the rest of the nation as to what we're doing to kind of be survey ready all the time.
Yes. I was just sharing with Tricia prior to this that Dr. Oz had actually shared an article yesterday that got picked up by Becker's, and it was all around the next stage of survey readiness and accreditation. And the spirit of that article was around elevating quality, safety, and making sure that the gaps in care are really closed. And we know that the dialysis space is one of the most heavily scrutinized when it comes to accreditation. And so, Tricia, let's just start kind of at the beginning because you were involved through the insourcing process and it has really helped your organization insource Tableau programs site after site. And so why don't you start by, sharing what was it like to be prepared for a survey through a third party versus insourced? And, what was the action plan and follow-up result, kind of comparing those two operations?
Sure. So as Brittany said, I was part of my organization during the time that we had third-party contracted services. And to be honest, there wasn't a lot of transparency in the day-to-day operations. And so it was very difficult when a surveyor would walk in for us to really know exactly what was going on day to day with the program. And so we would meet quarterly with them, but that's later on we're not able to really in real time address issues. And so a little bit of scrambling, going through, paper books and logs and making sure we had everything there and comparing contracted services policies, hospital policies, sometimes not in alignment. So it was very challenging when we had a third party performing our dialysis services.
I'll echo that. That was my experience as well. It was always very evident to the surveyor that this wasn't how normal practice occurred, and you could tell that things were not aligned, and there were communication gaps, and
Right.
just lots of
Right.
fumbling. And so when you own a program with a patient safety centric device with Tableau, you get with it all of the bells and whistles that help support a really streamlined, successful program. Some of those things are, Outset University and Tableau Hub. And so can you just share, through the lens of accreditation and survey readiness and compliant, how, those two platforms help support success?
Sure. So we discovered very early on as a health system that the Tableau in general was going to be a much easier device for the end user to use and learn on. And so then our efforts could be really focused more on intradialytic monitoring and access. And so really we use Tableau University and Tableau Hub to help in those early stages of training, making sure they were ready to use the machine. And so, yeah, we learned really early on as a health system that, gosh, this is kind of a game changer. This machine really makes it so much easier because it's sensor based. It really makes it so much easier for the end user, and they don't have to focus a lot of their time on learning the machine, where they can focus their time more on, as I said, intradialytic monitoring and learning how to access fistulas, grafts, etc. So yeah, we discovered that, yeah, this is going to be the way for us to go, because this is going to be really easy for the end users.
Mm-hmm. And all of that training is something that surveyors ask about. Prove
Yep.
you have done this. Show us the documentation.
Right.
And that too previously was a paper process and
Correct.
required manual entry and tracking. And so
Correct.
could you, touch on how the digitalized option of the offerings have helped close that gap as well?
Absolutely. So all of those learnings are in the cloud. So we can pull that data and provide it to the surveyor at any minute. We also keep internally our own competencies that we do initially, and then we do a yearly competency when we do our annual skills fair for our hospital. The dialysis area does their own annual skills, and then we sign off on those so that we have that internal documentation as well. So really have several layers. And so yes, when we've had our surveys, the last few surveys we've had, it's been very easy to pull all the data because they're my staff. So I have all of their data at the fingertips, where when we had third party, it was a huge group of nurses that served many hospitals, and they really might have picked any of those nurses that they might have not have been my facility for a couple of months. They might have been another facility, but because they've worked in my facility, they've pulled it. So then it was scrambling to try to find that person's data, where, I'm a dedicated leader of dialysis. I have everything at my fingertips that I've saved, so that I know what my team has done, and I can provide that very easily to the surveyors.
Mm-hmm. Another element of the survey process are things like cleaning logs and disinfection cycles
Yes.
and,
Yes.
preventative maintenance and work orders, and all of those, pieces and parts are housed in that cloud as well. Do you mind sharing how you leverage that for a successful survey?
Sure. So prior state, when we had our third party, that was some of our deficiencies were with our logs. They were paper logs. It was human driven, right? If the log wasn't signed off, we had to trust that that person that signed off actually did the disinfection. And so we did have some deficiencies in the area of disinfections. And so current state with Tableau, everything again is in the cloud. And with Tableau, it's a hard stop. We cannot do any treatments or move forward with anything unless the heat or the chemical disinfection has been performed. And once that's started, again, that data is saved in the cloud. Same thing with preventative maintenance, any service calls, all of that information is stored in the cloud. And if we did need service on a machine, our machines have wireless connectivity to our network. And so when I call the Outset, the 1-800 number, the Outset for service, if they're in California, they can see my information, my data on my machines, and they can tell me, they can see everything that we did. They can see the alarm that happened or whatever the issue is. And so it's really, really has streamlined getting things repaired. Sometimes it's something that we can fix. Sometimes it's just turn the machine off, turn it back on, reboot, and then we don't even have to wait for the engineer to come out. It's something we were able to fix. They were able to, right over the phone do that. So having that wireless connectivity and everything in the cloud has really been a game changer. The surveyors that have come through are so impressed that we will never have a fallout with disinfections because we can't. You cannot move them. You can't use that machine unless you have done the disinfections. And so they said that by far has been amazing, and they wish that that could be what happens with every dialysis machine. So,
well, sure, it's a huge patient safety feature.
absolutely.
I mean, knowing what you know now with the device and reflecting on the alternatives, you realize that there was some bending of rules, policies, and procedures,
Yes.
coloring outside the lines. I
Yes.
mean, there frankly is a little concern about practicing medicines with some of those, workflows and
Absolutely.
approaches.
Absolutely.
I know that you've lived through surveys through an outsourced model and an insourced model, and you had shared that the surveyors love the programs that you have built with Tableau. Can you share some of the best practices that you've received positive endorsement and feedback from them about?
Sure. So at our survey exit interviews with our executives and our leaders, the last two surveys that we've had, they actually made a point to discuss dialysis. And of course, dialysis is one of those, with every it's usually one of the top fives. And so they specifically said, this is by far one of the best practice dialysis programs we've ever seen in a hospital. Number one, having the Tableau with all of the technology and everything in the cloud, there won't be any human errors with disinfects. That's wonderful. That's amazing. Number two, we really tried to develop policies that were going to be simpler than prior. And we put a lot of nurse-driven protocols that were MEC approved into our policies so that it wouldn't be like we were practicing medicine. And I'm going to give you a couple examples that the surveyors specifically said, okay, so I see your order set says that your potassium bath should be a 3K. What is that? And that order was, the original order was from 2 days ago. What are you using today? Today we're using a 2K bath. Okay, so show me where it's okay that you don't have a new order that says 2K bath. And in our policy approved by MEC, there is a potassium sliding scale that is a nurse-driven based on the current serum. So the serum potassium from that day warranted that we would use a normal 2K bath. And they were like, great, you have it in policy. That's beautiful. You're not performing that, practicing medicine. We can see that in your policy very clear that it's approved by MEC. So that's just one example. We have lots of those kind of nurse-driven protocols through our policies. Fluid removal. We use CritLine, and in our order set, that's one of the options for us to use CritLine, that the nurse can drive the fluid removal based on the CritLine values. So again, we're not practicing medicine, we're using these nurse-driven protocols. Surveyors loved that. They really loved the fact that we had that very clearly in our policies, that the nurses could control those things with approval from medicine.
Mm-hmm. We had a question come in through the chat asking about how we utilize, Tableau and Tableau Hub and just operationally the Hep B status and, the unknown patient and how the surveyors responded to your workflows.
Sure. So I'm very fortunate at my campus that our Hep B, the turnaround time for our Hep B is about 45 minutes. So we are always able to, by the end of the treatment, be able to determine what the patient's Hep B status is. But if we did have an unknown, then very simply, that machine would go into a chemical disinfection at the end of the treatment. And then once that chemical disinfection is done, it's back into use with any other patient. So it's very, very easy process, but it's something that my team has to document in the EMR. That's part of our workflow, that every treatment we're documenting what the current Hep B status is. And then I audit that, and we self-audit. Other nurses will audit, another nurse and make sure that that hepatitis status is being documented with every treatment. And so we really have had no gaps at all with hepatitis at all.
Perfect. Thank you. So you just touched on some leadership aspects. So let's talk about that. Leadership is everything. Leadership drives quality,
Yep.
compliance, regulatory
Yep.
culture. And I know you're very passionate about, the leadership structure within your organization. So talk a little bit about that as it relates to survey readiness.
Sure. So when I set up my program in 2020, I really felt passionately that there had to be a dedicated leader to run the dialysis program. I really felt that there was so many moving parts. It's high risk, that you really needed to have someone that could really focus on it. I think that a lot of health systems think, well, we'll just have the ICU nurse manager also oversee dialysis, or we'll have one of the med-surg nurse managers also oversee dialysis. And unfortunately, I don't think that that's ever going to be successful, because they're just going to be stretched too thin. You really need to have a dedicated leader that's going to be, and it could be a working dedicated leader, meaning that that person is also doing treatments. If you have a smaller program, smaller hospital, that's okay. That can be a working leader that's also doing treatments, but there has to be somebody dedicated to overseeing that program and making sure that all the day-to-day operations, any quality issues are dealt with real time. So dedicated leadership is number one. That's my number one thing. And I've now helped almost 20 campuses convert their program from third party to insourced with Tableau. And every one of our programs within AdventHealth has dedicated leaders. And we have been wildly successful. But it's not just that. High performing, really engaged staff, that's the other key. That's the other key piece, because that's going to drive your quality when you have those really engaged staff. And then, of course, what we already spoke about, your MEC approved nurse driven protocols that will help your team really be able to function at the top of their license and their professionalism. So those are some of the key big things to when you're insourcing a program that will make it successful. And then you're Joint Commission ready every day. Every day, my team is Joint Commission ready. When Joint Commission is here, we don't do anything different. We are not going through and doing a sweep and running scared and checking. We're doing the same thing that we do every single day. And that's what a high functioning team really should do. And that's what we've really been able to achieve. But we've only been able to achieve that being insourced because we own it. We care about, what happens with our health, with our patients, and we're committed to, our health system and our patients. So.
Yeah. Thank you for that. I mean, that's the entire point of these accrediting bodies, to make sure that patients get a highly reliable, repeatable experience, whether they are
Yep.
on site or not. And that's one of the reasons they took away the advanced notification, is they wanted
Yep.
to see what practice is really like without a heads up. So I applaud you and your team for having that kind of standardization, because your results show it, demonstrate it. You guys have proven it. So you spoke about leadership and then also having an engaged team, and the combination between those things create an operational service line that, coupled with this patient-centric technology, has resulted in some phenomenal, impressive outcomes. And I
Yes.
think we need to celebrate and recognize you and the entire organization for that. But please share with everyone listening what those outcomes are?
Sure. So we did a retrospective look at the 4 years prior to us doing insourced dialysis. So 2016, 17, 18, 19, when we had our contracted services. And we looked at some of our quality metrics. One of the ones that we specifically looked at was the number of code blues that we had in the dialysis space during that 4 years. And we had 112, 14 in that range in that 4 year period of code blues. And unfortunately, of those 112 or 14, it was a 90% mortality. So 90% of those patients did not make it. And so we really, and that was actually one of the reasons why we wanted to be insourced. We really needed to say, we needed to change these metrics and keep our patients safe and say, we got to do better. We have to do better for our patients. And so that was one of the driving factors as a health system. If we can control it, maybe we can control the quality so much better. And it's been proven tenfold. So since we have insourced and we own our program, in the 6 years that we've been doing this, we've had 6 codes in 6 years and 0 mortality. So all of those patients have survived. And yeah, so, dialysis is high risk. But if you have a very engaged, high functioning, good critical thinking team, then you are going to reduce your risk to your patient so much better. And a dedicated leader. I'm here Monday through Friday. I know I have the pulse of what's going on with all of my patients that are in the building. And so, and that's not just true for me, that's true for all of our campuses that have insourced with dedicated leaders. They know what's going on with all the patients there, so code blues and CLABSI. So we had a pretty high rate of CLABSI as an institution prior to us insourcing. And we have been CLABSI free for 2.5 years. We've had no reportable CLABSIs for 2.5 years. And prior to that, I don't remember what our SIR rate was, but it was quite high. We had, I think, 8 or 10 per year. If we looked at each year prior to 2020, and now we've had 0 in 2.5 years. And then prior to that, I think we had 1 the year before that and 2. So we really have reduced CLABSI. We've reduced mortality, and it's all really due to us having this amazing insource team.
Mm-hmm. That, and the device that doesn't let you pass go. It doesn't let you create workarounds.
You're right, Brittany. The device we have found is much safer because it is sensor based. It tells you if there's an issue going on. So the nurse is not really guessing, where we had to, with prior machines, we had to kind of guess. We had to do a lot of troubleshooting. And so that really put our patients in jeopardy. And so the Tableau has really told us if there's an issue going on, and we're able to intervene very quickly. And so, yeah, all those things combined have really decreased our patients' risk.
Yeah, that troubleshooting just breeds anxiety amongst a team.
Right.
And that anxiety then, can lead to turnover and burnout and, all kinds of issues that impact your culture that ultimately impact the patient in a negative way. And you have had an impressive staff succession story to tell, and your patients can see it and they can feel it. So can you touch on how you recruit, retain, and then how that is ultimately resulting in patient satisfaction outcomes?
Sure. So initially, when we were going to convert our program in 2020, it was the beginning of COVID. And I had a lot of staffing challenges, right? We had a lot of nurses going to be travelers and leaving, and it was really, really difficult. So I had to think outside the box. I wasn't going to have a ready-made dialysis team. And actually, Brittany, you know this, but I'll tell the audience that I historically was not a dialysis nurse in my past. So prior to 2020, I've been a nurse a long time, over 30 years, but so I was a med surg nurse manager for many years, taught peritoneal dialysis, but never really did anything in the hemodialysis realm. So, so I said to myself, okay, I have to learn this, and I have to assemble a team that's going to be able to learn this as well. So it was challenging, but I really immersed myself. I went to three other AdventHealth campuses that had already converted to insourced program the year before. And I spent over a month with those nurse managers and with those nurses, and I really learned everything that I could. And then I started to assemble a team. As I said, I didn't have ready-made dialysis nurses, and it was very difficult at the time to recruit. But I said to myself, you know what? I spent this time, after about a week, I was like, this machine is easy. The machine is not a problem. So I spent the rest of my 3 or 4 weeks really learning the intradialytic monitoring, access issues, those kind of infection control, all of my other regulatory things that I needed to know. But the machine was really the easiest part to learn. Honestly, it was really the easiest part to learn. And so I knew right away that I was like, I know nurses that I currently work with that are really high performers, good critical thinkers. I learned this. I'm learning this in a month. You know, I'm here. I'm learning so much. I can bring them into the fold, have them do the same things, and I know they're going to be successful as well. And so that's what I did. I was able to find 2 nurses that had some cannulation experience in the past, so that was great. So I did hire them, but then the rest of my team were nurses that came from either ICU, PCU, or even med surg, if they were really high functioning and had good critical thinking. And we spent time at those other campuses, trained the trainer. They taught us everything that they knew. And then we came back. We were greatly successful. And then that next year, we started converting lots of other campuses, and they trained with my team. And now at this point, we've had 20 campuses that have trained with my team and I. I show them the administrative piece and the workflow piece, and then my team shows them the rest. And we've had probably over 100 nurses that have come through, and within the first few treatments, they're like, oh, this is really easy. The machine is really easy. Now I need to figure out how to access a fistula and access a graft. And so we really spend most of our time doing all those things, learning how to accesses and the monitoring of the patient. But the machine is really the easiest part for them to learn. So it's really streamlined our training process. And I'm proud to say that I have had no turnover of my staff in 4 years. Yeah. And so the team the team that I do have that have used other machines, they're like, yeah, hands down, this is the easiest machine I've ever used. And you know, it's great when you can work with people that are really love to come to work. And as a health system, not just my campus, but as a health system, we've had very low turnover in the dialysis realm. Generally, the nurses are very happy in the dialysis that do the insourced. So I really have never heard a negative with their experience with the Tableau machine. I really haven't. I haven't had any nurses say, yeah, I hate this machine. I'd rather go back to the old machine. It hasn't happened. It's so much easier to use. And it was so much quicker for me. The learning curve was so much faster. And it's all the same supplies. And they have a ready-made team in-house that can help them if they need to troubleshoot anything. Right. And so that has been an amazing thing for all of our campuses. It's all the same supplies that we're doing for our ICU treatment SLED and for HD treatments. And they have resources right here in the building that can help them because we've done thousands of treatments on Tableau.
Oh, yeah.
So if it's a new user in the ICU, they have somebody right there at the elbow that can help them. So, that's been
operational efficiency and cost savings has to produce a positive ROI. I mean, and I know you guys have measured that too across all of your sites.
We have. A few years ago, the AdventHealth corporate finance team, they did a look at all of the campuses that had converted from contracted services to insourced, and every campus had a positive ROI from 12 to 40%. Some campuses were smaller, so they had a lower ROI, but everybody had a return on investment. And my campus was at 28%. We had a 28% reduction in our cost from us doing our in-source team. And we had paid off the capital that we had put out within the first year and a half. We had already been able to pay off basically the capital that we had put forth with our return on investment, with our savings. So it has been really across the health system a huge win in the cost savings. But of course, the quality was the number one reason why we did this. But it's always great to have cost savings as well.
Yeah. So your team is happy. You have amazing outcomes and results. What are the patients telling you?
So when we were speaking earlier, I was thinking about that when we were talking about that it's stressful for the nurses when they have to troubleshoot.
Yeah.
It's also stressful for the patients, because most of these patients, right, they've been chronic, a lot of them are chronic patients. So they know that when the nurses are all gathered around the machine and they can't figure something out, that stresses the patient, because they're, and so the feedback from patients is generally, can I do my dialysis here as an outpatient? And I always, of course, have to say, no, I'm sorry. They're like, oh, it's so much quieter in the room. The machines are quieter and there's not as many alarms. And I actually feel better at the end of my treatment than I do, when I have my outpatient treatments. And so from a patient standpoint, that, and having an in-source team has also changed the patient experience, because there's a lot more monitoring, there's more engagement. And from a survey standpoint, that is very evident. When the surveyors were here, that was one of the things the surveyors said. They said, we could tell that the staff were not putting on a show for us. And they actually spoke to patients. The surveyors actually went and spoke to some of our patients. And the patients were very open to say, this is why I come to this hospital, because of this dialysis team. And I know I'm going to have dialysis when I'm here because they're a chronic patient. We have several patients that have said that. I come here because I know that they're going to monitor me really closely. They know me. I can tell they take care of me, and they are doing the right things. And so the surveyor said the same thing, that they could see that our natural flow of work was that we were doing those things naturally. It wasn't, oh, I have to put a mask on. Oh, I have to wash my hands. It was, so from a patient experience, our patient experience has definitely improved with an in-source team with Tableau.
I mean, that's what it's all about, taking care of the patient. Yep. So as we wrap up here, what do you want the audience to know or remember from today's conversation?
Sure. So this has come up actually many times. I've spoken to many health systems across the nation that have heard that we're, AdventHealth is doing lots of in-source dialysis, and we've been successful. And so I've had health systems throughout the nation ask me, how have you been able to do it? Because we're scared. We're afraid. CNOs, CMOs, they're afraid to do it because there's such a, I don't know what the word is, but right, there's this image that it's too complex. We're not going to be able to staff it. We're not going to be able to meet all the regulatory requirements. I'm really afraid to do an in-source because I feel like we're not going to be successful. And so I would say to you, it's not the big scary beast that we thought it was in the past. The Tableau machine makes it so much easier to be able to do these in-source programs and not worry about training for 6 weeks on a machine. And having the nurse have to have all this knowledge about trying to troubleshoot something because, so I say you should make the leap. We've never found a downside. and we're now 30 something, maybe 40 campuses deep into insourcing, that's not a mistake. That's not, I mean, the numbers don't lie. We've all been very successful doing this, but we followed this model, this dedicated leader model, using the Tableau machine, following simpler policies with nurse-driven protocols. Those are the key things that you really have to know. And then having that engaged team that's really high functioning and autonomous. So I would say if you're on the fence about it, don't be. And if you, I would be happy to speak to anybody in the future. If anybody has a question, I'd be happy to talk to you one-to-one. If you have any other specific questions, but don't be afraid. And the surveyor actually said that to me. She said, I wish that more hospitals would do in-source dialysis, because we are seeing in the AdventHealth system, we're seeing such a difference in the quality and the outcomes. And we very, very little deficiencies that have been found within the AdventHealth system since insourcing. So don't be afraid to do it. You can do it. There's a lot of work up front that you have to do to make sure you build the right team and have the right dedicated leader. But the rest of it, the training on the Tableau is easy. The clinical people from Tableau make it easy, and they really are the experts. The engineers, they come out and they fix our machines. The turnaround time is very quick. So there really isn't a downside to doing it. You're definitely going to improve the quality of care for your patients. Your patient experience will be better, and you will get cost savings and a return on investment. So those would be my closing things to say, that don't be afraid, just do it. So.
Love it. As we were preparing for this, you said, your goal for today was to share your information and knowledge with others, because at the end of the day, it benefits the patient. And so I just wanted to reiterate that, and thank you again for taking the time, because you and I can absolutely align and relate on that. The better the patient care is what we're here for. So
Absolutely.
thank you again, and everyone have a great day.
Well, thank you. Bye-bye.
Bye.